Good morning. It is 8:24. Welcome back to Great Day. It is the first day of September, new month, which means a lot of good things, including a visit from our friend from the Great White North. We're talking about Ames,
Not
Iowa.
yet.
Great White North. Wow.
Great advice from Medicap Pharmacy from Sherry. How are you?
I'm good. You know,
Good.
Jason said below normal September, but no snow, right, Jason?
Yeah, no, I don't understand. I'm a little leery of that, but we'll just go with what they say for now.
All right, so what kind of advice are you going to give us here today from Medicap?
I thought we would talk about men's health today because who wants to talk about it? No one, right?
She
Especially
thought
not
about the
men.
show, and she thought about how unhealthy you and I are. So,
Yeah, you say take one look.
yeah.
Well, it's true. It's one of those, a study came out recently, if you get less than 6 hours of sleep, you're basically destroying yourself. So, yay!
That's all of us here.
That's
yeah.
for everybody all around. But what can we
Everywhere.
do as far as men's health? Because a lot of time, you always see ad campaigns specifically geared towards guys, because guys don't always want to go.
Yeah, go to the doctor.
I mean, it's
I
as
saw
simple
Freddie
as that.
Hoiberg saying go to the
Go
doctor.
to the doctor,
Yeah.
right? He wore his little, and there's like a farmer, and I think they have an airplane pilot. You know, be a man, go to the doctor.
Right.
Kind of what the commercials are. There was actually a study that came out a few years ago by the American Academy of Family Physicians, and over half of the men surveyed had not seen their family physician for a physical within the last year. Men are about 24% more likely to die from pneumonia than women are, which is the second leading cause of vaccine preventable death. And more than 1 in 4 men say that they wait as long as possible before going to the doctor.
That's true.
That's true, right?
Yeah.
Do you find, though, now in just the society we live in with technology and going 24/7 that this falls for women as well? Because I, honestly, just reading the statistics you just said, I fall on that.
Hey, you're not hijacking this segment for you.
I'm just saying, I feel like
She's right,
women
though.
are guilty of this as well, just because we're go, go, go. Not that we aren't in tune with what's going on, maybe more than men, or want to say, hey, we should go get this checked out. But it was a couple years before I saw my family doctor for a while.
I think we're guilty for different reasons. I mean, I think women, it's like our excuse is, oh, we're so busy taking care of everyone else,
Right.
we don't have time. And men tend to maybe just want to ignore it, or, you know, the things that men will say is, I didn't think there was anything the doctor could do for me, or they want to wait until, you know, they think it's serious enough to go, or they don't want to take time off work, and you know, unless it's very important to go to the doctor. So I do think men and women, for different reasons, don't go to the doctor on a regular basis. Men often tend to think that they're healthy, even though they have chronic diseases that may need to be managed, like diabetes, high blood pressure. Even though they have that chronic disease, they would still say that they're overall healthy. So, but there's hope. In this same study, over 80% of men surveyed said that they would go to the doctor if their significant other asked them to or told them to. So I'm going to call this one.
Or took them.
Oh, well,
It can't be their idea. It has to be somebody else's.
Yeah.
my husband would call this the nag factor, right?
No, because you would say, I don't really want to be here, but my wife said I better show up. You know, so I agree.
Exactly.
And that's their excuse of going. Because from a guy's standpoint, I'm not sure if you look at it this way, Jason, but if you go to a doctor, you're asking for help. And you think you're strong enough to get through something yourself. You don't want to, you know, admit that you need some help with something.
Exactly. So women nag because it's effective. So you go to the so you do go to the doctor. So I have a little quiz for you guys.
Quiz.
I didn't know
Yeah.
it'd be a quiz.
Is this just for the guys?
You can
That's
answer
okay.
too if they
You're
don't
one of the
get it
guys,
right.
Jackie. You can
I'm going to
answer.
drink my coffee.
Okay, so at what age should men begin having their cholesterol checked regularly? 55, 35, 50, or 65?
Boy.
Those aren't in order.
55?
I'll go 35.
Probably the low end. I'm going to say 55.
35, actually.
That's
So
low end, yeah.
potentially earlier if you have diabetes, high blood pressure, if you smoke, or a family history of heart disease. So.
Well, if you don't have it checked, you don't know if it's high, Jason.
That's true.
Okay.
Yeah.
That's my excuse.
I didn't know it was high.
At what age should you begin being screened for colorectal cancer?
50.
50.
Excellent. I didn't have to give you choices. That's great. Possibly earlier if you have a family
If it's
history.
in the family history, right.
Or if you have symptoms that would lead them to do it.
And we showed you that here.
Exactly. Yes. If you have high blood pressure, high cholesterol, what other disease should you be screened for?
Ooh.
I'll give you some choices.
High blood pressure, high cholesterol.
Hepatitis, diabetes, glaucoma, and gout.
I was going to say diabetes.
Diabetes.
Yeah, diabetes. Those diseases often go hand in hand, and it's really difficult if you do have all of them.
Really?
It's sort of a trifecta in that we can never really get one under control unless we are working to get them all under control.
Oh.
So they kind of go together a little bit.
Okay.
Here's an easy one for you. The most important things you can do to stay healthy are,
Don't smoke.
yes,
Get sleep.
get sleep, eat, exercise, eat healthy, drink alcohol in moderation, avoid tobacco, we said, and then get recommended screening and preventative tests, and take medications if you are prescribed them. So
Okay.
we talk about that a lot, like, you know, how many people will go to the physician, the doctor will actually prescribe a medication for them. About 50% of the prescriptions don't ever get filled, and of the
Wow.
ones that do get filled, they often don't get refilled after 3 months. So.
Wow.
Oh, I didn't realize that.
Yeah, it's
Yeah, I
it's
can be
actually a
guilty
pretty
of
high
that,
number.
too.
People think too, like especially if you with high blood pressure, let's say, you don't really feel sick most of the
Right.
time, and so it's easy to just forget to
It's true.
take that medication. So if you're between the ages of 65 and 75, again men, and if you've ever smoked more than 100 cigarettes, what other disease should you be screened for? This is uncommon.
Lung cancer.
Lung cancer would probably be good. It's actually abdominal aortic aneurysm, so it's
Oh,
relatively
really?
common
Really?
in men in that age group who have smoked quite a bit. And the aorta is the major vessel that leaves the heart and carries blood to the rest of the
It's like
body.
a garden hose, right?
It
I mean,
is
it's
pretty
big.
large, yeah. And actually, an aortic aneurysm is, if you think about a balloon where you have like a bulge in it. And
Like
it
when your garden
becomes-
hose breaks.
Right, and if that ruptures, it's pretty immediate medical crisis. So you want to have that
Wow.
screened if you're
Didn't
in
know
those
that one.
ages and you
100
smoke.
cigarettes?
More than 100 cigarettes. So I think that
What would
means
that
in a
That's- and
lifetime.
what 5 packs?
So
If you had 5 packs.
Wow.
In your
Cigarettes.
lifetime?
Yeah.
I believe so, yeah. So,
Oof.
So
I bet you have
you're in
inhaled
that
that.
wheelhouse, Jackie, aren't you?
No.
No.
That's
Well,
one thing
she's
I can
not that
always.
age.
No, I never have either.
But that's
Yeah.
one thing I can
never
always
have.
click on my like,
Yeah.
not smoker, never been.
it's good. Keep it that way.
You know, I'll drink every day, but
I tried,
I'm
I
not
couldn't
going to
do it.
smoke.
Yeah.
Yeah.
Last question. Which
Yeah.
vaccine should you have after turning 65?
Pneumonia.
Yes. And there's actually now.
You must live with a doctor.
I got it. Here's a target.
Jason
Well, the
does
problem
well.
with living with a doctor is that they listen to people whine all day and they don't want to hear me. You know what
like,
I mean?
"I don't
so it's
feel
really
well." I
it's
don't care.
useless to live with one, really. They don't want to listen.
They don't want to listen to
No,
you. Yeah.
no.
It's like the hairdresser's kids always needs haircuts.
Yes.
Yeah,
right?
or the mechanic's cars always need repair.
Right,
Yeah.
right.
Yep. Yep.
There are 2 pneumonia vaccines now recommended for people over age 65, and that is new. We used to just have one called Pneumovax 23, which had 23 strains of pneumonia virus in it, and that was what was traditionally recommended over the age of 65. There's now a second vaccine called Prevnar 13, which has 13 strains of pneumonia virus, and so people over 65 need both of those, and they need to be separated by a year. So.
And those are different strains totally, so it's like 33 different strains or some overlap?
There's a little bit of crossover,
Okay,
so
okay.
it's not quite 33, but yeah, do need both of those. So,
right.
and then the last thing is prostate cancer. Nobody really wants to talk about that. There are screening tests for it, but I just remind people that those are screening tests, so they are not diagnostic tests. And the other thing with prostate cancer is it's usually slow growing. Most people don't die from prostate cancer, although some people can. So it's important to kind of talk to your doctor about risk factors, what you can do to lower your risk factors if you have them, if you should be screened. If you are screened and you have a high result, what are the next steps? Is it something they're going to watch? Is it something they're going to monitor? Do they need to do other tests, things like that? So if you have symptoms, certainly talk to your physician about it.
If you watch TV for more than 20 minutes or so, you'll see the pills that they have on there
Right.
for prostate.
Right, which is the other thing. So the symptoms don't always have to mean cancer. It could mean something that's non-cancerous, which is what we call benign prostatic hyperplasia, which is just some swelling and inflammation of the prostate that presses on both the bladder and the urethra, which causes the symptoms. So
Well, thank goodness you keep coming in. I think we did pretty decent.
you guys
on
did
that.
so, too,
great.
yeah.
Hopefully,
Not
if you keep
bad.
watching, you'll be able to pass some tests, but more importantly, just go see your doctor.
And I would say that you guys got 100%. So.
Oh, yeah.
Good job
Yeah.
between the three of us. Now, if you have any questions like these or about anything we talked about, there's a bunch of different Medicap pharmacies we can go into and talk to someone like you, right?
Absolutely. Any of our pharmacists would be happy to help you. You can also check us out on Twitter and Facebook, Medicap Central Iowa.
Perfect.
So,
Good to see you.
good job.
And we need to start talking flu vaccinations. Speaking
Yes.
of vaccinations, really soon, right?
Yes, I think next month, the 1st of October, first Tuesday of
Bringing
October, we're
needles
going to
with
bring
you?
needles and
Okay.
get you guys all
Yeah.
vaccinated.
All right.
So,
Something
yeah.
to look forward to.